I chose family medicine, I guess, at the same time that I chose medicine in general as a career. And I think I kind of came to that decision a little bit later. And I had this experience with children in Peru when I was working with a social program that really kind of highlighted social determinants of health. And I really started questioning things like how does literacy impact health? How does secure housing and food and access to nutrition impact overall health? And I guess as I started to think about these questions, I started to look at medicine as a potential advocacy point. And that's when I decided on medicine, and then family medicine more in terms of the best means to access that and really focusing on preventative care. The University of Toronto was actually the only program throughout the country that I could find that had a program like the Global Health Education Initiative. And that was really the focus of going into medicine, was to be able to continue my studies in global health as well. So that was a really big driver for the U of T. And then I also just love the idea of Toronto being a very culturally diverse Canadian city. It really is. It does represent kind of a global community, and so that's why I chose the U of T. So the Global Health Education Initiative has certainly played a big role right now. And then I've also, I guess, through the GHEI, been able to form a lot of connections through that as well. And so one of the groups that I'm working with has done a lot of work regarding the interim federal health cuts and promoting refugee health. I initially went into medicine thinking that I'd spend a lot of my life overseas and wanted to kind of acquire the skills of a physician to go overseas. And I started off in my medical school doing an elective in Rwanda and trying to get more international experience. I was actually really lucky to be training in Hamilton at the time of the Code Red series. So the Hamilton Spec put out a series of articles that ended up winning awards, and it just divided the city into neighborhoods, and it looks purely at statistics. And at one point they found that there was a 21-year life expectancy discrepancy between the richest and the poorest neighborhood in a single city. So that was shocking, and it really brought to light for me that global health was in our own backyard. And since that experience, I've been trying to do a lot more work just locally. I've been really lucky and had the opportunity to go up to Moose Factory for part of my teaching practice, and certainly northern Canadian cities are of interest, but I think even in Toronto there's a lot of social determinants to consider, and there's a lot of poverty and marginalized populations within our city too. For somebody who's moving to a new city for a residency program and not really knowing anybody here, it was just an incredible community that I got to step into right away. So I'm very grateful for that. Just really kind of inspired and inspiring people, both kind of on the teacher side, where we get to hear their stories and their experiences, but then also the residents have the most incredible stories too. Some of migration, some prior to medical school did actually work with like MSF or other international aid organizations. So it's just been inspirational being around them. And I've also formed some really close friendships too with other residents of the program, so I'm quite grateful for that.